Hello and welcome to Child Welfare, lecture number 6. We will be covering psychological maltreatment. It's pretty tricky in determining psychological maltreatment and finding it, and largely because broken bones and bruises and scars. You can see those things. We can find them out through X-rays or observing. Psychological maltreatment tends to be more of observation of behaviors, word of mouth, or actually witnessing this sort of event. And so, in that sense, it's a bit more tricky. The additional difficulty with psychological maltreatment is the way you talk to a 16, 17, or 18-year-old and the resources they have. If you speak in the same manner, to a 4, 5, 6-year-old are very different in terms of how the kids take it and the sort of impact that it will have on them. A 16-year-old can brush off some of the things that may be said to them and have resources in the form of other family that they themselves can have access to on their own, or friends' family members for that matter. Whereas a 6-year-old does not have those sort of options, so it gets a bit more difficult. I always like to include this quote in any of the work that I'm doing and teaching around kids. In large part, and this is Donald Winnicott, who did a tremendous amount of work in looking at kids and therapy and art. And one of the beautiful things about his work is that he wasn't trying to just look at what was happening uh, intrapsychically in the child, meaning within their own sort of psychological development, but how that is impacted within the family. And so, in some ways, this quote in itself is a way of looking at family system, that you cannot describe a baby unto itself. That when you are describing a baby, you are describing other parts of the child, how they are cared for, how they are taken care of, that it's not so easily separated. So we'll start with two of the bigger concepts that you should be aware of. Psychological neglect is the failing to meet the emotional needs of the child. And that makes sense when we consider the word neglect. And psychological abuse is engaging in non-physical acts that directly harm the child, especially their health. The statement notes that while there are no definitive statistics on the prevalence of kids who experience psychological abuse, large studies conducted in the UK and the US found around 8 to 9% of women and 4% of men reported exposure to severe mental abuse during childhood. The other tricky piece to this whole concept of psychological abuse or maltreatment is that the question comes up, um, isn't sexual abuse or physical abuse also a form of psychological maltreatment? And I think really what we try to do is instead of having all these overlapping definitions, because then we get into legal debates and discussions about charges and all this other stuff, typically what we do is try to make these things neat and tidy, where sexual abuse pretty plainly has to do with this sort of intrusive, abusive behavior in a sexual nature upon a child, and can have psychological outcomes as a result. We try to focus this definition of psychological uh, maltreatment separately, in that we're not looking at, if we're looking at the specific definition of psychological maltreatment, um, we have already then established that there is not physical abuse or sexual abuse um, that causes the psychological maltreatment. Can all those things happen? Yes. So in other words, a parent or caretaker or whomever can be psychologically abusive and then also physically abusive. And so we look at these as separate components and not necessarily overlapping. Now, in terms of uh, is emotional abuse as damaging as physical abuse, some of the research that is out there concludes that children who've been exposed to this to psychological maltreatment have higher rates of poor attachment, uh, externalizing behaviors, acting out behaviors, poor impulse control, learning problems, poor self-esteem, engaging in self-destructive or self-abusive behavior, and also a greater likelihood of having some very serious psychological um, uh, problems in comparison to kids who have not experienced this sort of abuse. So, some of the physical indicators of emotional maltreatment, these kids may show what we call non-organic failure to thrive, which we have spoken about a bit before. They will also exhibit speech disorders and developmental delays. So there are a host of ramifications, consequences, outcomes of emotional maltreatment. There are a number of categories uh, when we think of emotional abuse. And Barlow and Schrader McMillan, and this is a 2010 study, this is referenced in your book, outline these in these 5 categories as emotional unavailability, negative attitudes, developmentally inappropriate interactions with the child, failure to recognize the child's individuality, and failure to promote social adaptation. Now, understand that all of these categories fall under this larger thing of what we call emotional abuse, and not these aren't sort of diagnosable conditions. But when we're thinking about how the caretaker or parent or whomever it is that's engaging in this behavior, when we think about specifically what behaviors they're engaging in, these are just ways of categorizing them to try to make sense. Now, some of the consequences, which I just briefly touched on, have to do with self-esteem, depression, anxiety, suicide ideation, reactivity, substance abuse. Uh, they themselves can become abusive. Borderline personality disorder, which, if you're not familiar with, has a lot to do with problems in interpersonal relationships, a lot of pushing and pulling in relationships instead of stable, consistent relationships. They can also have social and antisocial functioning, which consists of problems empathizing with others, problems with attachment. Uh, they can have learning problems, which I discussed a little bit. But there can also be some other physical indicators like asthma, hypertension, somatic complaints, increased mortality risks, non-organic failure to thrive, and self-injurious behaviors. Now, these physical indicators are pretty big if we take into consideration the um, ACEs scale, which I believe we've touched base on before, the Adverse Childhood Experiences scale, because we know that kids who are exposed to more of these things and more often of these things have higher rates of physical problems, and as they get older, develop these physical problems, which leads to a shortened lifespan as well as a poorer quality of life during the course of their life. Some behavioral indicators that you'll see, a lot of self-soothing sort of stuff, these habit disorders, sucking, biting, and rocking. These are ways of trying these kids to try to use to soothe themselves. They can also display conduct disorders. They can become bullies, steal, lie, hurt others. They can develop neurotic traits like anxiety, sleep disorders, depression. You can have behavioral extremes ranging from being overly compliant to aggressive and defiant. Um, they can become overly adaptive. dependent on others to an extreme. They can engage in self-destructive behavior, and they can become very cruel to others and animals, as well as, especially the older they get, engage in delinquent behaviors. There's no uniform legal definition across the United States, and all but 2 states address emotional abuse in their definitions of what abuse is. Most focus the definitions on the child's outcome, and emotional neglect really is less covered, and I explained earlier some of the reasons why. Um, we do attempt to define this typically as sort of like a mental harm. Um, and it does get tricky because, again, there isn't like an x-ray out there that shows you clearly what's going on with the child. The other issue is there's really a lack of a diagnostic code. You don't find this in the DSM. You do find their outcomes in the DSM, such as things like depression or anxiety or delinquency. Those sort of things you can find under the DSM coding, but there isn't something specifically for this. You can also find a reactive attachment disorder as well, which may have some elements of this as well. The closest thing we have our V codes, which are areas that need to be addressed in terms of psychopathology, but aren't necessarily an axis diagnosis. In terms of the DSM-4, it'd be an axis 1 or an axis 2. DSM-5 did away with the axes, of course. We also get into this debate about what's the difference between emotional versus psychological. And emotional may be something along the lines of regulating affect, um, hypersensitivity, that sort of thing. Whereas with psychological, we may be talking about um, organizing one's view of themselves and the world around them based on their experiences. So a lot of overlapping sort of stuff, but some differences as well. Plus, the psychological, some of these definitions tend to focus more on parental behaviors, and it's difficult behind closed doors, which often happens with abuse. It's difficult to see these sorts of things, and more or less we tend to find that we retroactively come across these things when we're looking at the outcomes of the children, how they're doing academically, behaviorally, and how they see themselves. We covered this idea, this McGee and Wolf classification, when we looked at the definitions in a previous slide. But the other piece to this that we have to keep in consideration is parental intent. Were they intending to be harmful? Did they see this as a form of trying to motivate their child? And that's where we really have to be clear about what sort of things were said. Now, I'll give you an example. I worked with a family where I had a 12-year-old child that I worked with. It was probably 10 or 12, on an inpatient psychiatric unit. And during the course of a family therapy session, the mother, who was obviously very frustrated and overwhelmed with the child's defiant, aggressive behaviors, said in the session that she had to go get a lump biopsied, and she told this to the child. And I hope that it turns out to be malignant, so I die and don't have to be around you. Now, to me, that fulfills this definition of psychological maltreatment in, you know, showing that they not only don't want to be around their child, but they would risk death to not be around their child. And where does that leave the 10-year-old? And when I called it into DCFS, of course, they did take it. But in terms of their outcomes, what they wanted to see happen was already happening. They were in family therapy. He was in individual therapy. She was in individual therapy. There was medication going on. So, and if this is a sequence A report, meaning one of the first reports made, DCFS would likely want to see what's happening with the child in the course of therapy. Now, within 12 months, the child ended up hanging himself. And I received a call within a few months after his death from the mother asking if I had witnessed anything or observed anything that would give me an indication that he might do this sort of stuff. And at that point, it would have been easy to say to her, well, of course I did, because I was there in the family session when you said such things, and I was the one who made the hotline call. But it seemed a little uh, pointless at the time, considering the loss and the mourning she was going through, which she really was, and likely some of the things that she had said regarding wishing that she had passed away were more born out of her frustration and feeling inadequate around how to um, parent this child. Certainly not to excuse her behavior, but just to try to understand it. Now, the American Professional Society on the Abuse of Children have their own professional definition where they look at a pattern or extreme incidents. Now, the case that I just presented to you, that I talked a little bit about, if there had been more than one instance of that, it would likely fall under this APSAC definition. And part of the definition has to do with conveying to the child that they are unloved, which is certainly the case example that I gave you, a way that I would think of it. Glazer's definition, which is also reviewed in the book, looks at emotional unavailability of the parent, unresponsiveness and neglect, negative attributions and misattributions to the child. So the parent attributing very specific negative feelings to the child, whether they are real or not. Developmentally inappropriate or inconsistent interactions with the child. And I did have one case where the parent did a lot of like overly pleasing, like they were buddy buddy with a child going out drinking, and this was like a 13-year-old kid, and all that sort of stuff, which I think would also fall under this sort of category. Failure to recognize or acknowledge the child's individuality and psychological boundaries, as well as failing to promote the child's own social adaptation. Now, a way to look at this, to try to piece this out, is to try to think of these parent-child interactions on a continuum of extreme from one end to the other. And looking at it from on one end you have the positive, the other end to like the dysfunctional or maltreatment end of the continuum. And a nice way to try to sort this out, to sort of neatly package this, is to look at if on one end of the extreme, is there both intent and harm? And that would easily would fall into that checklist of severe maltreatment. If there was no intent and no harm, meaning the parent certainly didn't mean to engage in psychological maltreatment, but something that they said or had been doing was present but not intentional, but no harm, no foul, they would fall into the mild maltreatment category. If there was either intent or harm, but not both, it would fall into the mild category. And that's kind of a nice way to sort of parse this out and try to understand the definition in a different way. Now, in terms of measurements, there's some nice stuff in your text a bit about the National Child Abuse and Neglect Data System. And it's collected from each state, and they compile this data into information to determine which category is where how many kids fall into which category. And in 2010, they came up with a 8.1% of all maltreatment dealt with emotional maltreatment. And so we do know that there are scales out there. There's a 2006 study that's also cited in your book that talks about the conflict tactics scale, which looks like it was developed in '79. The child behavior checklist looks at behavioral problems and social competencies. So there are a number of scales out there that have some decent reliability. Because there's not a lot of work out there, validity is difficult to measure. And also because some of the definitions are a bit vague, that makes it a bit tricky as well. Now, in terms of overlap with other forms of maltreatment, what we often found is that um, separate from the legal definitions, we often found that if there was physical abuse, more times than not, psychological abuse was present. If psychological maltreatment was present, physical abuse was present nearly half of the time. So one tends to be pretty connected to the other. Um, and that's in the clinical sample, meaning kids who've been seen in treatment in hospitals or outpatient settings. In a larger sort of community sample, where physical abuse was present, psychological maltreatment was present 93% of the time, so very similar to the clinical sample, but somewhat different in the community sample. If psychological maltreatment was present, physical abuse was present 18% of the time. So both show a significant drop-off um, in terms of if psychological maltreatment, then not necessarily physical abuse, um, uh, but certainly higher rates in the clinical samples. Now, the National Incidence Study categorized emotional neglect having 11 subtypes, including inadequate nurturance or affection, domestic violence, knowingly permitting drug or alcohol abuse, knowingly permitting other maladaptive behaviors, refusal to follow provided needed care for diagnosed emotional or behavioral impairments, failure to seek needed care for emotional or behavioral impairment problems, overprotectiveness, inadequate structure, inappropriately advanced expectations, exposure to maladaptive behaviors and environments, as well as other inattention to developmental or emotional needs. And this is on page 136, so you can kind of read the details of this. And in terms of their study, some of the things they came up with, they found that there was a significant decrease in emotional abuse endangerment since 1993, but the rate wasn't any different from that reported in 1986. They also found that there was a significant increase in emotional neglect endangerment between all of their studies. So they've done a study in 86, 93, and then 2005, 2006. So some of the reasons for these, we're not entirely sure. It could be because we have a better understanding and use of some of these terms, or if there has been a true increase or decrease in the specific type of maltreatment that we're talking about. Now, the National Society for the Prevention of Cruelty to Children data looked at community samples of adults reporting on their childhood. So it's a retrospective report. And about 33% of these folks said that they've been victims of emotional abuse during their childhood, and they reported being terrified of their parents, screamed at, being called lazy or worthless. Um, it shows that essentially emotional abuse, although in terms of our findings through DCFS, is somewhat rare, this 8% finding, we do find that overall it's not a rare event that happens to people in the community about a third of the time. So certainly nothing that is a rare event. Now we can talk about this idea of resilience. And some of the resilient factors we know for kids are having a supportive adult, and it doesn't necessarily have to be somebody in the home. It can be a coach or a teacher or a neighbor, somebody who they can trust and be supportive of them to help guide them in these difficult times. Um, and there's a lot of research out there about resilience and how that is a key component of it. Somebody in the church, a pastor, or somebody from the congregation, anything along those lines, or an uncle. Um, but we also know that kids who are at greater risk or greater risk for harm are those kids where there is domestic violence in the home. They are at risk for themselves being abused, as well as at risk for the ongoing psychological outcomes as a result of abuse. In terms of looking at Maslow's hierarchy, we need to have psychological needs met before you can achieve your full potential. So some of the theory out there already points to how significant psychological health is in terms of leading to one's autonomy. Erickson's theory, his 8 stages of man, looked at the importance of navigating these crises that you move from one developmental stage to the next. Um, and of course, basic trust being the foundational event that happens in infancy, trust with the caregiver, and if that is not met, if basic trust is not met, then establishing safe and stable relationships with others in the future certainly will not be met. Attachment theory is also very interesting in looking at this idea of psychological maltreatment and references some of Erickson's stuff when it's talking about the secure base and looking at the future in terms of model relationships. So, what do we do when we're assessing? We certainly have to take age into consideration, and not just age, but development. I'm skipping ahead a little bit to this uh, uh, point in 3, in that you can have a 12-year-old who's being talked to in a certain way by their parent, and if they are functioning a bit more like a 7-year-old or a 6-year-old, their reactions to the behavior is going to be much more, uh, the consequences are going to be much greater as opposed to a 12-year-old who's functioning at their age or higher. We also have to take into consideration their reaction, how they perceive these interactions from the parent. So it's not just the uh, 6-year-old who's being talked to in a certain way, but what they then do afterwards, and how they then are impacted. That's a big part of this as well. So the case scenarios here, we're going to talk. I'm going to put these up on Blackboard as part of the discussion. So, and this will give you a better sense of this age and development piece. And this is the second case about Lucy. So referencing these things, you'll kind of, as you go through the Blackboard piece, the discussion board piece, you'll figure out what I'm talking about. And this is brain changes in maltreatment, which will also be in the unit. Maltreatment disorder. Some of the things that we know in terms of brain development is that the connection to the hippocampus is weak. In girls, we can also see connection to the amygdala is weak. It removes the mediating action to understand when and where to be afraid, so that fight or flight sort of piece is missing, as well as this may help to diagnose some of the things that we've been talking about. You'll see this in the previous video that I had listed on here in terms of maltreatment and brain changes. All right, good luck.